Today it is 5th of March. Yesterday, 4th of March, it is World Obesity Day. Often it is termed as Anti-Obesity Day or World Obesity Day. The problem of obesity is increasing day by day throughout the world, not only in developed countries like America or UK, like that. Even in India, it is increasing in an alarming way. Obesity is considered as a non-communicable disease. Obesity prone, obese people are prone for diabetes, blood pressure, that is the hypertension, even cancer. Obese women are more prone for breast cancer, and then the obese people are more prone for diabetes and blood pressure and heart attack and cancer, etc. So obesity, what is obesity? And obesity, it is measured in terms of body mass index, and it is calculated by the formula weight in kg divided by height in meter square. Okay, it is difficult for me to calculate that, all that division and all that. If you think that way, waist circumference. So we measure at the level of umbilicus. The doctors, they measure at the level of umbilicus. That is known as waist. The waist circumference should not be more than 40 inches in case of male, and then 35 or 38 in case of female. So the waistline should be more in case of female, and especially this menopausal woman, when once they stop menstruating, when once they attain menopause, tendency for them to, because of the hormonal imbalance, hormonal changes, tendency for them to put on weight, and they are equal to men to develop different complications of obesity. So what is the cause for obesity? It is multifactorial: genetic, environmental, socio-cultural, economic. So in this way, there are many causes for obesity. Both the parents are obese, tendency for the children to develop obesity. Nowadays, childhood obesity is also increasing. Just young girls and boys, they are putting on weight. When we were students, we never used to see obese woman. In fact, we used to comment with a sense of humor that if any woman, a little obese woman, we used to think that, oh, she is the wife of a deputy commissioner, wife of a very rich people, that's why she is obese, like that. So now, when we were students, more of communicable diseases we used to get. Now the communicable diseases are controlled. There is no cholera, the typhoid is reduced, gastroenteritis is also reducing, tuberculosis is controlled, leprosy is eliminated. So most of the communicable diseases are controlled. Some of the communicable diseases are eradicated. For example, smallpox. When we were students, we used to see many cases of smallpox. Now it is eradicated throughout the world. Anyway, this obesity, how to prevent obesity? See, we should not put on weight. So 1 gram of protein gives 4 calories. 1 gram of fat gives 9 calories. 1 gram of carbohydrate gives 4 calories. So approximate principles and their calorie. See how much calorie? Protein and carbohydrate gives 4 calories per gram, whereas the fat, 1 gram of fat gives 9 calories of energy. So whatever the fatty food, the fat, ghee, butter, those are the saturated fat. The fat that is present in the mutton, fat that is present in the egg, fat. So the animal fat is rich in saturated fat compared to polyunsaturated fatty acids. Whereas the groundnut oil, it is liquid. So the fat which will be solidified during winter, it is rich in saturated fat. The fat which remains in the liquid form, for example, as I said, groundnut oil, safflower, gingerly oil. So these are all the fat from vegetable origin remains in the liquid form during winter also. So the source of fat in our diet should be more from a vegetable origin rather than animal origin. There is an exception. The fish oil remains, it is rich in omega fatty acid, rich in unsaturated fatty acid, and so the fish oil will remain in the liquid form, whereas the other fat will be solidified during winter. And there is an exception, the coconut, although it is from vegetable origin, that will be solidified during winter. And whatever we eat, we should be cautious. Even a piece of chocolate, a Cadbury's chocolate, how much calories it gives. The sweets are rich in fat. The fat is tasty. We add fat to increase the taste of the food. The more and more fat means more tasty. The food will be more tasty. Often the people, they say, "Nan anna uta madalla, I don't eat rice and all that, and I eat only chapati." Friends, please remember, whatever the 100 grams of rice, anna, 100 grams of chapati, 100 grams of jow roti, 100 grams of chapati gives the same, ragi mudde gives the same calorie. But if you eat ragi mudde, or if you eat chapati, or if you eat jow roti, you will not be hungry soon because of the roughage content. ಅದರೊಳಗೆ ತೌಡ್ನಂಶ ಇರುತ್ತೆ, ರಫೇಜ್ ಕಂಟೆಂಟ್. That's why we will not be hungry soon. Whereas if we eat the rice, no fiber content, because the paddy, entire ragi we powder it and we prepare ragi mudde. Entire wheat we prepare chapati. Like that, the fiber content will be there. Whereas in rice, the paddy, the outer layer outer husk is removed, then more and more polished, and so the this fiber content in rice will be very less. That's why we will be hungry soon. So the why every year the 4th of March is observed as Anti-Obesity Day or World Obesity Day, because to disseminate the information so that the more people, so the diet, whatever the advice that we give for the diabetes people, diet and exercise, that is applicable for prevention of obesity also. So the diet should be rich in fiber content, and then the small quantity more frequently, and more than that, do exercise. Walking is the best exercise according to World Health Organization. So everybody, at least half an hour we have to walk. Now the people, they argue, now it is corona, we are afraid to go out. Don't worry, within the house only you do just walk. Or if you are having treadmill, okay, use the treadmill, do exercise. Or if you are having the knowledge of yoga, Surya Namaskara you do 12 times. It is a wonderful exercise. Relax, do exercise, eat small quantity more frequently, small quantity of food more frequently, and do the exercise. And then avoid saturated fat, especially from animal origin. And this is how you can avoid obesity. Thank you very much. Please disseminate this information to others. Thank you.